Hey, everybody. Hello, hello, hello. It is good to be back. I'll give a couple minutes for some people to come in. Really, really excited to be here. All right. Hello, hello, hello. Sorry I'm a few minutes late. Just had a patient in here just wrapping up leaving and had an issue with his ride. So he was an older gentleman, so I had to kind of wait with him, make sure he got into the right car. We don't want any of those problems. Um, so yeah, as we're waiting for some people to come in, for those of you that don't know me, my name is Dr. Nick Licamelli. I'm a physical therapist and I work with Team 30MJ. Um, yeah, I'm really excited to be here. Today, we're going to talk about maintenance physical therapy, kind of start the conversation there, and then see where it takes us. Someone had asked me, one of my athletes that I was working with asked me, so what do you do like on a daily basis, like to stay injury free as a physical therapist and bodybuilder? What do you do? And I was like, it's a great question. And it's almost like if you ask someone, like if someone tells you something or gives you advice and you say, okay, now what would you tell your own child about the situation? Like, would the advice be any different? Yeah, I think we'll probably start there, and I'll just kind of say what things that I do on a daily, weekly, monthly, yearly basis that have seemed to help keep me relatively injury free. I'm not injury free or pain free, that's for sure. And we could probably get into that too a little bit. Some things that I've dealt with over the years and am maybe currently dealing with, how I've managed them, how I've treated them. I guess we'll start. And some of the things that that are really important are not so much a set of special exercises or stretches that will help reduce injury or prevent injury. A lot of times it's more, my favorite word, multifactorial. So some of the things that I have learned over the years is that it's important to be flexible, and that's flexible with exercise technique, exercise volume, exercise selection. All of these things is important to be able to kind of bend and weave through these things as needed, because over the years things are going to pop up. I have had pain, like I mentioned. I think we all have, and I think my first line of defense, if I do feel any pain, is do another rep. Just kind of see how it feels. If it goes away, great. If it gets worse, maybe it's time to change it up a little bit. Maybe change the position if we're doing like a lateral raise and it hurts. You get one like sharp pain in your shoulder. Okay, like put the weight down a little bit, take it out, and kind of go for another rep and see how it feels. Not exactly scientific, but there are so many times when things like that happen that probably just get forgotten about because we just move around it. So I think that's really important to understand the difference between like green light pain, yellow light pain, and red light pain. So if there's any kind of pain that continues to get worse, so if you do that and you keep doing that movement and it gets worse, you try to change your arm position, you try to change the height that you're going, and it's still getting you and kind of get that sharp pain, then maybe it's time to switch it up a bit more. Any kind of pain that's constant, no real rhyme or reason, like why it comes or goes, it's just kind of always there, flares up with no like mechanism as to why, numbness, tingling, those are things that you want to possibly get checked out by a healthcare provider like a physical therapist or your primary doctor, orthopedic, neurologist, things like that. But those are rare. Those are rare. So yeah, those are kind of the main principles of remaining injury free and reducing the risk of injury is monitoring workload, listening to your body. If I wake up in the morning and things don't feel right, or I slept the wrong way in an exercise or movement that I'm trying to um, uh, do that day is painful, then I'll respect that, and I'll be able to modify around it. Knowing that, and there was a time in my life when I would just kind of push through that stuff because the squat is king, right? So push through any kind of pain, aches or pains, hip pain, back pain. Um, and because you have to squat or because you have to do this on this particular day. Um, Being flexible with the things that I said before, volume, range of motion, load, those kind of things, but also your overall schedule throughout the week. If you are sick and haven't slept at night because you're coughing all night, or you have a sore throat, but the next day is, leg day, it may be better to hold off that day and train the next day. Now that involves some flexibility, right? If you're super strict, that may seem like a loss or seem like it would cause you stress. But being able to look at yourself and say, okay, today is just not the day. I would be better off resting today, and my workout would be way more productive if I did it tomorrow. Having the ability to do that is really important, and I think Jeff. We all talk about it, but I think Jeff is living proof of that. How his training nowadays, he has to be flexible like that in order to kind of work around different aches or pains. So just quickly about some things that I've had come up. I've maybe like 3 injuries or things that I've kind of dealt with over the years that I could remember. First was really sharp stabbing hip pain at the bottom of my squat. It was one of the most uncomfortable feelings that I think I've ever felt up at that point. I was in college, and I still feel it now, like just thinking about it. It's like when you get deep into the squat, about past 90 degrees, I would get this sharp pain in my hip. Didn't really know why. But I modified around it, and I tried different things. I tried decreasing the load. That didn't help. I tried decreasing the range of motion, but that had to cut it so short that I didn't feel stable. Like I felt like I just wasn't getting deep enough, and I was just like taxing my lower back, as I wasn't really getting a lot of like knee and hip bending. So I don't know what made me try, but I tried. Oh, I used to warm up with a band, a resistance band around my knees, and do some squats. So I realized that my warm-up sets didn't hurt. So then I tried band with the bar on my back, and my hip didn't hurt. So I did that for quite a bit. I loaded the bar with my normal weight, and for some reason the band just allowed me to, it just allowed the muscles of my hip to contract a bit differently perhaps, and it just changed the way the force was going through my hip. That worked for a little bit until it didn't. So then I could only do things like hack squats, leg presses sometimes if they felt okay. But ultimately I had to modify all the way down to like jump squats, holding some dumbbells and just doing like plyometrics. And then after just doing that for a time period, I started slowly working back into the squat, and it never really hurt me after that. And to this day, I use a heel lift. So my barbell squat is more of a high bar squat, more of a quad knee dominant type squat. And every once in a while, very rarely, I'll feel that sensation again. But usually I'll just kind of change up my foot position or not go quite as deep in the squat, and it goes away and doesn't come back. But that's kind of how I worked around it. I never saw a doctor or physical therapist about it. Just kind of what I did to kind of work around it. And that was when I was in college, like I said, so I wasn't even an actual physical therapist at the time. But I would give that advice now. I think I did a good job modifying it, modifying my routine. I didn't, freak out, get really upset that I wasn't going to be able to train anymore. I didn't just push through it. So I think I approached it logically, and it seemed to work. So yeah, that was my story about my hip and how I managed it. So we talk about maintenance physical therapy. What is it? Again, I don't think it's really a prescription. I think it's just taking these examples and these factors, having the flexibility to kind of work around it a bit. So I'll take a break from myself and I'll answer Aqua Hero's question here. So thank you so much for the question. Let's dive in here. So I have a partial supraspinatus tear, but my MD is mystified because bench press makes it worse, but I can't overhead press with dumbbells with minimal or even no pain. That's a great, great kind of like question there, because it really shows how we're so individual and variable. And you can have 10 people in a room with the same exact partial supraspinatus tear, and everyone could present differently. Some people will have pain lifting their arm up in the air. Some people will have no pain at all. Some people will have pain with the bench press and the overhead press. Some people will have pain with just the bench press. Some people will have pain just with the overhead press. So I don't know that he or she should be mystified by that. That's just how it is. I think we're all so different, and we're all conditioned to certain stresses and force before the injury happens, right? So you likely have been in the weight room for quite some time over the years before this happened. And we also don't know if this was an injury in the gym or if this has been there for 10, 15 years. I don't even know how old you are. Maybe you're 15, in which case you can't be 15 years old. But you can have these kind of things on an MRI, and we had them for a long time, and we just don't really know that it's there. So sometimes they're asymptomatic. Sometimes they're very symptomatic. Sometimes they do require surgery or cortisone injection sometimes, just to kind of calm it down if we really can't do anything with it. If it's affecting our daily lives, we can't do anything in the gym. It's waking us up at nighttime. Physical therapy is really hard because it's so painful. Those are times when you want to look to things like anti-inflammatory medications, injections, but definitely not the first line of defense. So, yeah, it's interesting that that the bench press makes it worse, but the overhead press doesn't. So I'm not sure if you've kind of tried to modify your program or any changes you've tried to make, but we can definitely talk about how we can bench press, without flaring it up. Do you think it's possible for me to start bench pressing? You took the words out of my mouth. Yeah, I do remote consultations for sure. I could. You could find me on Instagram if you want. You could shoot me a direct message, or my email should be in the description once this is posted. Or 3DMJ, they have my information up there too on the website. So some things. Oh, 53. Okay, you got it. My pleasure. So with the bench press, just some things off the top of my head, and we can definitely dive in more when we talk to each other. But I would want to know what makes it better, what makes it worse. Is it hurting in the gym as you're benching? Is it only hurting after the gym? Where do you feel that? You don't have to answer these now in the chat, but just to kind of get the ball rolling a bit about where my head is. Is it a pinpoint spot in your shoulder, or is it more like around the whole shoulder? Does it ever shoot down to your arm? If it does, how far does it go? Is it just pain? Is there any numbness or tingling? Any issues with your neck? Ever have anything like this in the past, or is this the first time you're dealing with it? Have you tried any other kinds of bench pressing, like dumbbell or machine, or even like push-ups, or is it just any kind of horizontal press that kind of gets you? We could definitely dive into all that stuff. We could check range of motion, check load, maybe change your hand position on the bar or dumbbells. And then if all those don't work, another thing we can do is isometrics. So the idea is that we want to, if benching is the goal, then rather than drop you down all the way to like some band exercises like in a PT clinic, rather than go from at the top of the mountain all the way down, we can take baby steps down and test it out and see how it feels. So we're only modifying as much as we have to. So if we've tried all those things that I said, we've tried different bar and versus dumbbell, we've tried modifying range of motion, we've tried modifying load, we've tried a machine, nothing seems to help. Well, then we just keep kind of going down and down and down. And if we have to, we can do isometrics. I've seen that work really, really well. So what that would look like is if you have, you could do it in like a squat rack or power rack, or you can do it on a machine. So picture a hammer strength chest press machine. You can usually you can adjust the like where the bar, how far down the bar goes. So we'll get to take a few different points of the range of motion. Say we'll start out here, load the machine up as high as it goes, and then you're just going to slowly ramp up like 10, 20, 30, 40, 50, 60, 75, and then kind of ramp back down. And then we do a couple reps there and then change the setting so it goes down further, and then do isometrics again there, kind of ramp up to about 75% max, and then relax, change the setting so it's here, and do the same thing. So you're getting, you're still getting the specificity of that movement. You're still loading those joints and soft tissues, but perhaps in this hypothetical example, maybe it's not painful. So then that is how we would do it. We would start with some isometrics at different ranges of motion. We could increase the intensity. So in my example, I just stopped this at 75% of effort, but you could push, we can get to 100%. Hold that for a good 5 or 10 seconds, and then bring it back down, and then change the range of motion. And then from there, we just increase the range a bit. So we increase the range of freedom, so to speak. And then maybe we start doing like a nice eccentric and concentric in a shortened range of motion, and then slowly start increasing that until we get back up to the bench press. That's kind of the mindset and like the framework of how I usually approach those kind of things. But I think too many times when people have pain, especially like with the squat for some reason, like a lot of people in healthcare will just say, okay, don't squat. It's bad for your knees, bad for your back. Do these bridges with a band on your knees. When I think if the goal is to get back in the gym and do these movements, that should be respected. And we should try to work with that to keep you in the gym as best as possible. Okay, let's see. Wes Robinson, hey Nick, thanks for you and everyone at 3DMJ. Love the channel. Oh man, that means so much to me. Thank you. You're the reason we do it, man. You're the reason that we're here. So I very much appreciate the kind words. Thank you. Aqua Hero. Okay, here we go again. Good. Okay, more information. After the bench, feels in the middle of the bicep. Went to a physiatrist. He said, actually my shoulder. Okay. The bicep is a tricky muscle. Sometimes it's referred to as another rotator cuff muscle because the tendon kind of sinks right into the shoulder joint. So sometimes it would be a bicep tendon thing, but either way, a lot of times I don't really care what structure it is because, like we said before, if I had a magic wand and I could magically see what structure was torn or damaged, if any, and it was a bicep tendon that had some inflammation on it versus a supraspinatus tendon versus a subscapularis tendon versus a pec tendon. Either way, as long as there's no red flags, we're still going to take the same approach that we kind of walk through. We're still going to find out what makes it better, what makes it worse, lean into the things that make it better, and try to modify around the things that make it worse. So the actual structure that is potentially involved, for my purposes, really doesn't make a difference. But if I were operating on you, then I want to know which structure I'm going to operate on. Yeah, for our purposes, it's good to know, but not something that I would say we need to know to guide our treatment. All right. Wes Robinson. Okay, here we go. I'm 32, mild degenerative disc disease. My back doesn't bother me really throughout the day, but mostly stiff in the morning. or if I don't warm up enough before squats and deadlifts. Um, yeah, so 32. You're a young spring chicken. I have been feeling old as of recent because more and more people that I'm in rooms with are younger than me. And that's why I don't watch college sports, because as I watch the games, in my mind, I'm thinking they're like old, men. And then I remember that they're like 10 to 15 years younger than me. And then I automatically get very angry and I shut the TV off. No, the reason I don't watch college sports is because I don't have time to. But no, I'm not. I'm not old. I'm 36, but 32. So degenerative disc disease sounds scary, and I wish they would stop putting this on MRIs and X-rays and stuff like that. Um, all it really means is that first, any image, X-ray or MRI, it's someone taking a picture, and then it's another someone interpreting that picture. So they've done studies where they have the same image, and several different radiologists who read the image come up with different conclusions. So someone may look at your scan and say mild degenerative disc disease. Someone else may look at that and say unremarkable. Someone else may look at it and say moderate degenerative disc disease. So take it with a grain of salt. That mild degenerative disc disease is nothing serious or that should be, should hold you back in any way or needs to be operated on or something like that. It's just a scary way to say that there's a bit less space in between the bodies of the vertebrae of your back. Very common, normal with aging over the age of 30, to 40. We're probably going to see some of those changes. Nothing actionable. It's kind of like wrinkles on our skin or like gray hair, but just like on the inside of our spines. So it seems like it's not really holding you back from doing things that you want to do. It just seems like if you don't warm up, that's when you feel it. But that's a good detail, because then you can use, clearly it likes movement. It likes to get stretched out, warmed up, blood flow, increase your body temperature. So a good warm up helps it feel better. So you can use that throughout your day. If it gets stiff in the morning, then maybe before you get out of bed or right when you get out of bed, you can run through a bit of your warm up that you would do at the gym. Whether it's some stretches or like some mobility drills, something maybe like just a few minutes when you get up in the morning. If that seems to work in the gym, then you can try it when you wake up in the morning or throughout the day. If it gets stiff, you can have a few of those exercises or movements in your back pocket to use to help reduce some of that stiffness. And ultimately, a lot of these things will resolve with a bit of modification and a bit of rest and these kind of mobility things that will help kind of in the short term. Most important thing, though, is that you're still training, because load ultimately is going to help this thing until it doesn't. If it makes it worse, then we know we have to change something. But the idea is you want to keep doing as much as you could be doing without making things worse. So yeah, the insight that the warm up makes you feel better in the gym, I think you can probably use that maybe throughout your day and try to mimic some of your warm up if you have to. Unless you're doing like burpees and jump squats, then you don't want to wake up your wife if she's still sleeping in bed. I don't even know if you're married. Don't know if you have a wife, have a girlfriend, have a boyfriend. I don't know. But that may be interesting. You may get a few interesting looks from the dog or the cat too if you start doing some mobility drills when you wake up in the morning. All right, let's see. Aquahero, that was my concern. My physiatrist wanted me to do these band things that felt useless. Yeah, I don't know. I think they have their place, because so in my brick and mortar practice, my physical therapy office, I don't usually treat bodybuilders. I treat a handful of weightlifters and bodybuilders and athletes in here, but most of my athletes and weightlifters are through 3DMJ and through you guys. So most of it is virtual, and so in here though, I treat a lot of general population folks, and um, sometimes they're coming in with not a lot of exercise experience, a really painful shoulder, for example, and I can't just start having them do like modified range of motion bench presses. They don't even know what a bench press is, and I have no care in the world to ever do a bench press. They just want to carry like the pot of spaghetti at Christmas Eve from the kitchen to the dining room. So it kind of changes it a bit. So um, yes, I think sometimes those bands and like low level PT type exercises, um, for us, for bodybuilders, I think after we've exhausted all their options, we've kind of gone down those steps. We just can't find a way to do the movements without pain. So if in that example, like the isometrics with the machine, if that's still painful and it's still getting worse, still keeping you up at night, which would I can never imagine after all those different changes it would still do that. But even if it did, then maybe we can do some banded exercises, like some easy like rotations or like easy like lifts or something like that with the band. So they may have their place, but I think they're used um, inappropriately and I guess prematurely. So that's funny that your physiatrist wanted me to do the band exercises. Don't tell your physiatrist that some guy on YouTube said to not do the band exercises, because that's not what I'm saying. Listen to your doctor, of course. They see you in person. They know your situation better than I do. So please go with his or her advice. Don't tell him that some guy on the internet said that he doesn't know what he's talking about. It's not what I'm saying at all. I like your idea. Start at the top, work your way downwards till something works. Yeah, that's what I found to be the best for me personally. Like my hip story, kind of what I did with that, and also the gym is more than just a hobby for us, right? The gym is it's our anchor. We're passionate about it. It's the best time of our day for some of us, and to just not go to the gym uh, is a big hit mentally. Not only physically, you're dealing with the pain, but so I like to try my best to keep people in the gym. It's what we like to do. It's our happy place. Get the gym bag, get in the car, go to the gym, be in the environment, smell the gym, be with the people in the gym. All that has value, even if we're doing some like isometrics on a hammer strength machine. There's still benefit to getting to there, staying in the routine, as opposed to just taking time completely off. You never thought of that? Yeah, no way I was going to do those little band things. Not saying not to do it, but yeah. Cool. Yeah, I look forward to talking, man. Yeah, reach out to me, and I'd love to schedule something with you. Yes, I am in New Jersey. Yep. Yes, sir. Can you tell by my voice? I don't think I have an accent, but when I go other places and I ask for like a glass of water, people say, "Oh, you're from New Jersey." I don't know. I don't think I have a heavy New Jersey accent. There are people that have heavy New Jersey accents. Whoo, baby. I don't think I'm one of them, but I guess I have a bit of an accent. Okay, Wes, I went through about 2 months of PT. Okay, still lingering around, slight aggravation day after squats or deads. Do you have any suggestions for maintenance, any exercises to avoid? Tough to say. I think kind of like I was saying, if you notice that the warm-up helps it, maybe you can sprinkle some of those in throughout your day. I think that would help a lot. And then if it's sore after your squat and deadlift day, then you can maybe schedule a day off from the gym or like an active recovery day after that day, so you don't have to go in the gym the next day and like hit back or something, or something that's going to add more load to your system. You can lean into that kind of approach where you're kind of modifying your week around those things. But how to make it stop? The goal is not to just keep modifying around it. How do we make it stop? Um, I guess it depends. Let me see here. So did it seems like the 2 months of physical therapy helped a little bit because you said it's still lingering. So was it worse and it got better, but it's still kind of hanging around? In that case, maybe you just need some more time. Um, Maybe you just need a bit more time. What I have noticed when the symptoms are after the fact, so when the symptoms are after training and not so much in the moment, sometimes it's a volume thing. You can maybe pull on a volume string to help with this situation. So you could consider um, cutting a set off of squats and deadlifts, or maybe going a bit further away from failure. All those things I think are good options to try and then see how it feels the next day. And anytime you make a change or try to make a change, just make sure you give it a good, um, you know, 2 weeks of time. This way we know that if you feel great, we know that's not just a fluke, like maybe it's just like a random good day. And also we know that if it's painful, we don't just say, oh, it didn't work, because maybe that's just a painful day. So give it a good 2 weeks, if not more, of trying something and then see how that feels. But I don't think there's any exercise you should avoid. I think we still have a lot of things you can work around or work with squats and deadlifts. There's all different variations of those too. So if it's just like a barbell squat that bothers it, maybe try a hack squat or leg press or a split squat, like a Bulgarian split squat. They will really, hit your legs in a really great way and perhaps not cause a lot of the soreness. So that's an option too. If you don't want to, if you're not married to the squat and you're okay not doing it for a time period or even the deadlift, you can swap it out with other exercises and just see if that does the trick. Run that through for a couple weeks, and then you could always look to reintegrate the squat. But the good thing about that approach is that you're not doing the squat and doing like leg extensions and leg curls. In my example, you're still doing squatting patterns. You're still hinging at the hip. You're still loading the hips and the knees and the ankles, and your low back is getting stabilized. So those options are not a bad option because you're still getting the specificity of the squat more so than if you were just to give up on the exercises. Let's see. But if you want to dive in more, please, reach out and we can definitely dive in more. I know it's kind of hard to give advice and have a back and forth here, but feel free to reach out to me and I'd love to help more if you'd like. All right, let's see. Hello, big fan of the content. My name is Dan. Hi, Dan. I'm a physio. Hey, all right. As well, you're working as a coach. Okay, cool. I've had some clients that are experiencing pain. When do rehab blocks? Okay. I've had some clients that are experiencing pain. Oh, we do rehab block. Got it. We do rehab blocks, but at what point do I think it's necessary to stop training and start dedicated physical therapy? Obviously, stop training as in doing the usual exercises, not full stop. Gotcha. Okay. That's a good question. I think the physical therapy should be a combination of both. So in a session with a weightlifter or bodybuilder, in my brick and mortar, my in-person office, it would be a little bit of both. So there may be some heat involved to start, and then some manual therapy perhaps to kind of desensitize the area a little bit and allow us to do more loading and strengthening. Perhaps there will be, depending on what the injury is, if there's some kind of instability at the joint, some kind of dislocation, perhaps we'll do some stability work. So maybe we'll do some like rhythmic stabilization where they're lying down with their arm up straight and I'm trying to make their arm move and they're resisting me. Maybe there is time for some weight bearing, like like a 3-point stance where they have one arm like on a table and then their feet on the floor and they're just stabilizing, like contracting like serratus and like controlling their scapula. And then we go into more like the more like weightlifting type exercises, maybe some landmine presses or some rows, like some heavy rows and curls, triceps, things like that. But there's an arm bike in here, so perhaps we warm up with the arm bike, So I think there's a combination of physical therapy / weightlifting activities at all times. And so maybe if you could think of it like that instead of when do we stop, traditional weightlifting exercises and lean more into like the PT side of things. But it can get hairy. I know it's tough to like really differentiate like when one is another. Yeah, are you coaching bodybuilders or powerlifters or like a different sport? Because that definitely matters. If it's soccer players or figure skaters or dancers, that all depends on who you're coaching and then how obviously the rehab would go. Also, how long have you been practicing? That's awesome. And where are you from? You said physio, so is it in the UK, Australia? Let me know. Okay. Thanks for the info. You got it, man. My pleasure. Let's see. Getting old sucks. When I was 17, I fell through a roof and got up and walked it off. Today, I could sprain my back bending over to pick up my socks. Oh, man. I hear you. Yeah, I'm noticing that I'm getting that moving has sounds to it that I never had before. I'll be on the floor with my daughters or something, and like I go to get up, and I'm just like, ugh, oh. They're like, "Daddy, what's wrong with you?" No, they haven't asked me that question yet, but I'm making sure that they don't. They can't see me if I have aches and pains. That's not okay. I need to be invincible to them. No, just kidding. But my daughters are 6, 4, and 1. So they're at the age where I'm still like the man. They still think I'm funny. They still think I'm the strongest person in the world. They think I'm the funniest person in the world. They think because their selection size is not that big. So, I mean, I'm the greatest and I'm the worst as well. So, it's a really fun phase of life for sure, especially this time of year. It's a lot of fun. Thanks, Nick. Yeah, I wouldn't want to wake up the wife and kids with burpees or vomiting in the morning first. Yeah. Vomit and burpees in the morning are not a good combination. All right, let's see. I have sharp localized pain in the front of my left shoulder during converging incline press. Okay, no problems with flies or flat presses. Any idea what that could be? Okay, my first thought is it's great that you're doing so much. You're able to do so much. Sometimes it's the opposite. Sometimes it's like can't do flies, can't do flat presses. All I could do is like a converging incline press. So you're in a good spot. What I would say, since you're doing so much already, is and that converging incline press. When do you feel the pain? Is it during the movement? Is it like at the bottom of the movement? Is it like at the top when they start converging? Or is it random? Like, does it not hurt in the moment? Is it more of like a load thing where all parts of the range of motion feel great during the warm-up sets, and then once you get to sets of 12, 10, 8, maybe like sets of 6 is when it starts bothering you? Or is it the opposite? Do heavy sets feel okay, and then like the lighter sets tend to make it hurt? any info you can give me, and then we could talk more about it. That would help. Let's see. Oh, so you're coaching not bodybuilders, some powerlifters. Chile, nice. Latin America, yeah. Also cool. General fitness people, nice, very cool. What's the temperature there, by the way, in Chile? It is 40 something degrees here, pouring cold rain, and then the temperature is supposed to drop 25 degrees Fahrenheit overnight. So, yeah, let me know what the temperature is there. 33, graduated at 23, so 10 years. Oh, cool. Nice. Very cool. Tuning in from Germany. Hey, man. All right, cool. That's awesome. Welcome. Now, all good. If I had to try to type in German, it would be it wouldn't even be funny because I don't know any German words. I know some Spanish, not German, that's for sure, and very little French. I went to France to speak on BFR with Nick Rolnick, BFR Pros, shout out, and that was pretty cool. I had to learn basic language for France, but it's so different. Like Spanish, Italian, they're kind of similar, but then like German, French, that's a whole like Polish, like that's a whole different animal. So, all right, let's see here. Of 40 to 50 guys who lift, golf, etc. Everyone of my buddies is in the same spot: shoulder, back, knee, elbow. But all local PTs are for young kids or boomers. And you're in New Jersey. Oh my gosh, where in New Jersey? My office is in Totowa. So Totowa is right near Clifton. What are the big towns are around here? There's Clifton, Little Falls, Verona. Patterson is kind of like in the area. About 20-minute drive from the Lincoln Tunnel in New York City. Oh, Princeton. Yeah, that's a hike, but that's a hike. Yeah. No. Well, we actually, I have a golf net in a room here in my office because so many people want to get back to golf, like you just said. So we take some swings and kind of get back into the specificity of things, right? If it's not a squat or a bench they want to get back to, if it's golf, well, we're going to take some swings and we're going to check this out and see what point of the movement you have pain, and we'll try to break it down a little bit. And if people are lifters and golfers, I'm your guy. But even if not coming to me in person, please share my info to them, and I'd love to help virtually if I can. 59 degrees Fahrenheit in your city. Okay. So it's not that hot. All right. The pain is okay. So the converging incline press, awesome. The pain is at the top of the movement. Heavier load is worse. Okay. So the good thing about that is that, and I'm just assuming the goal is like hypertrophy and strength. We know that stretched position is the most important. So if you're having pain at the top when they converge, then my recommendation would be do like 3/4 of the way up. Just go right up before that pain starts and then back down. Give a good pause, like under tension, like 1, 2, 3, and then push up and then back down, nice and slow, 1, 2, 3. And the reason that I wanted to go slow and the pause is because then you won't have to load it up to get that training effect. You almost are making it harder for yourself. But that's just because as you increase the load, it gets painful. So similar to the concept of BFR, blood flow restriction training, If you can't lift heavy loads because of pain or some other reason, you put the cuff on and it pre-fatigues you, makes the movement harder to do so that you can use a lighter load and get the same benefit as a heavy load. So those long negatives and the pauses at the bottom in that lengthened position under tension, that would be doing that. So you would be getting a training effect with a lighter load, so you don't have to load it heavily. And so that's what I would say. I would say try that. Try to go only the first like 3/4 of the movement, and then try using a load that isn't quite as heavy, because then you can, by doing it, as I said, you could still get a training effect with a relatively lighter load. And I'm assuming there's no red flags like, numbness, tingling, burning pain, pain that's constant, pain that's waking you up at nighttime, pain that has no rhyme or reason why it comes. Although, because you said that you feel it at the top of the motion, that's already a good sign that it's musculoskeletal and not something like more sinister, because you can reproduce it. That's a sign that it's something that you can deal with, like we're talking about here. Okay, let's see. Hey, a physical therapist in Argentina. I've never had so many PTs on the live here. This is awesome. That's great. So Argentina, what's the temperature there? I just want to make myself jealous. Of you guys, I guess. So welcome. Glad to have you here. And what do I think about therapeutic ultrasound? I haven't looked at the research on ultrasound in a very long time, because the last time I looked at the research for ultrasound, it really wasn't too impressive. Ultrasound used to get used all the time, and basically it's for those, I know obviously but for people that may not know, ultrasound, yes, it can be used to look at a baby, like inside of a mother. It can be used to see, like as a diagnostic tool. Sometimes you can see structures with an ultrasound, but it's also been used in the past for pain relief and tissue healing. And so basically, you don't feel anything, but the gel kind of gets squirted on a little wand, and then it just kind of gets rubbed on a certain area for 8 to 10 minutes. And it was thought to have some kind of like deep heating effect, like the sound waves of the ultrasound would go in there and kind of heat up the area, and it would promote some kind of healing. And it was used all the time. My first physical therapy job as an aide, the most tedious job was filling up the ultrasound gels with the big ultrasound container, like the big bottle of ultrasound. I would fill up like the little tinier bottles, like ketchup at a diner, and I would fill, because they used it for every patient all the time. But it's easy to placebo in research, different than like electric stim. So electric stim is hard to placebo in a study, because either you feel it or you don't, and the feeling of it is the benefit. So it's hard to give one wavelength of someone of electric stimulation to someone, and then give another wave of stimulation to another, and compare, because the tingly feeling is still there. So that's almost impossible to placebo. Ultrasound, however, is so easily placeboed because you don't feel anything. So they do studies where they don't turn the machine on, and they just rub the wand on the spot, and then they'll have another group where they actually have the machine on, and they really haven't found much difference. As far as last time I checked a lot of the research on ultrasound. Is it going to hurt? No. Whenever we have something like this, I like to divide it in, is this going to calm it down or build it up? So is this going to calm down the symptoms, or is it going to build up the resiliency of the tissues around it? So ultrasound would be in the calm it down area. It's not claiming to make anything stronger or more resilient. It's just aiming to have some kind of like healing, pain relief. So I would put a bunch of things in this column of calm it down: cupping, massage, manual therapy, joint mobilizations, acupuncture, heat, ice, electric stim, um, anything, dry needling, anything out there would go in that like calm it down section. Taping, different like creams and stuff, all in the calm it down section. So how do I filter out all that noise in there? Foam rolling, another one. I kind of like to think, okay, number one, is it going to make it worse? Most of the time, not. Number two, is it expensive? Because, well, number two would be, is there research behind it? So is it going to work? So number one, is it going to hurt me? And number two, is there research on it? Number three, is it expensive? So if it's not going to hurt me and it's really expensive, like, I don't know, like a red light infrared mask or something that I put on my face or on my shoulder that's $2,000 and it's supposed to help my arthritis. Is there research on it? No. Is it going to hurt? No. Do I want to spend $3,000 on something that may or may not work? I don't know. I don't know your financial situation, but I probably would want to put that money to something else. So then it's a no for me. However, if it's not going to hurt me, there's decent research on it, and it's not expensive, then I would say give it a shot. Because we're all just trying to just decrease that pain so that we can do more and build it up. Even if there's not research on it, that doesn't mean that you can't do it. So even ultrasound, I wouldn't do ultrasound on someone in my clinic and bill their insurance for ultrasound. But if there's someone out there that has had a great experience with ultrasound in the past and they want to do ultrasound again, I don't even have a machine in here to do it. But my point is, if someone had a great experience with it in the past, who am I to tell them no? If it worked for them and they know that it may be a placebo effect, who cares? If it's working, they can keep doing it. It's not going to hurt them. And if they're okay with paying whatever they're paying for it, go ahead. So it's not only that, I'm not like a research snob where if it doesn't have randomized control trials and meta-analyses, like you can't use it. Because there are things we use all the time that don't have a ton of research on them, but we know that it seems like it helps and it's not going to hurt us. So that's kind of the filter that I put those things through. So ultrasound, I don't use it just because of the lack of evidence. But if someone were to really enjoy it and had a great experience with it in the past, I would have this conversation with them. I would say it's probably not going to hurt. There's not much research to say that it does much. But if it's within your means financially and you want to give it a shot, go right ahead. I would just make sure that they know that it has to be followed with some kind of strengthening therapeutic exercise, some kind of functional activity that would help them get back to their goals. All right. Cool. Yeah, great. Try that, the converging incline press kind of strategy, and then let me know. Let me know how it goes. DM me and let me know, or message me somewhere. And I'm curious, and then we can I can help. If that doesn't do the trick, then we can dive in a bit more if you'd like. All right, 80 degrees Fahrenheit, too hot. Oh man, yeah, I'm not sympathetic to you that it's 80 degrees is too hot for you. I'm always cold, so 80 degrees. I went to Sacramento, California. And I competed there, what was it, 2022 maybe? It was like 110 degrees. I loved it. I loved every second of it. My veins were like all dilated and I just felt so warm. Here in New Jersey, I just feel like ice flows through my veins all the time. Even in the summertime. In the summertime, you walk in places and the air conditioning is blasting. It's like freezing. So sometimes I just sit in my car in the summer and just defrost. Anyway, so there's got to be people out there that do that, especially bodybuilders and weightlifters, cutting weight, or come on, you have to be out there and people that feel me on that because yeah, I'm just always cold. Okay, yep, you remember that from school. Um, you never used it personally or any modalities, to be completely honest. Yeah, again, they have their place, um, but I just wouldn't, I wouldn't buy an $8,000 machine to keep in my office. I don't even know if that's how much they cost. Um, but yeah, it's always a conversation to be had. Ooh, Uruguay. And 82.4 degree. I love how you automatically just tell me the temperature. Um, oh man, okay. Let's see. Um, what do you think about neurotherapy, MD, physical medicine and rehabilitation? Um, what is neurotherapy? I'm not sure I know what you mean. I may know it, but maybe just by a different name. Um, sorry, if you want to just clarify, that'd be awesome. Thank you. Um, ooh, Buenos Aires. I'm trying to pronounce it like it's supposed to be pronounced. Buenos Aires. Buenos Aires. 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 Not Buenos Aires. Buenos Aires. Um, a lot of humidity. Yeah, it feels like 200 degrees. Yeah, that may be too much. That's awesome. Cool. A lot of people from all over the place. That's so awesome. It never ceases to amaze me that like we can all be connected through like these pieces of plastic, right? And bodybuilding. Right? I think that's so cool that it brings us all together. Oh, neuro rehab. Oh, gotcha. Okay. Um, wait, is that the same? Oh no, different. I'm sorry, different person. Neuro rehab specialist. Recently, okay, training for squat bench deadlift for stroke patients. Super effective. Yes. Do I have experience with that? Yes, yes, yes. Um, not so much stroke patients, but patients with Parkinson's and MS. So we have actually a heavy bag here for boxing, and we have mitts and like a body suit that like you wear around your midsection so they could hit like to the body. We do a ton of boxing, and with the heavy bag, I'll have usually the Parkinson's. I'll have them stand in front of the bag and take like a big step with their left foot and punch with their right, and then step back. Big step with their left and punch with their right. And getting that like force and that power with that reciprocal motion, that helps. It really helps a lot. And then we usually work into some kind of squat, bench, deadlift. Usually, I don't do bench with them just because I don't know, no reason. I think it's great that you do that. We do definitely more like deadlifting. Maybe not with a bar, but we definitely hold like dumbbells and lift right from the floor or from an elevated surface. Have them hinging over, bending over, picking up the dumbbell. Ton of squats. So yeah, that's awesome. That's so cool that you're doing that. Um, I think it's really cool how we as bodybuilders and weightlifters can integrate that stuff into our practice and kind of you know. Change the game a little bit. I will say that what helped me the most in physical therapy school was having an interest in bodybuilding before PT school, like diving into muscle magazines and like the online forums and articles and Muscle and Fitness and T Nation. When I got to physical therapy school, like anatomy was a joke because I just knew all of it already, like the functions of the muscles and like the origins. And I didn't know all of that stuff, but for the most part, I knew a ton about the body before PT school because of bodybuilding. So who knew? All right, let's see. Complementary injection-based technique using local anesthetics. Um, okay, so I think so. You mean like an epidural injection, like in the back for like sciatica or like back pain? Um, If that is what you're talking about, then yeah, I like it. I think for the right patient, it's perfect. Happens all the time in here. We see patients that come in, and I have my approach, and I'm gonna educate them on pain, and I'm gonna break down the movement patterns, and we're gonna use a little manual therapy, a little strengthening, and whole good home exercise program, and this thing's just getting worse and worse and worse, and their back's on fire. It's shooting down their leg, and I just can't make a dent in the symptoms. Um, Go back to the doctor, and maybe an injection is exactly what they need. Get the injection, come back, all of a sudden they're a new man, new woman, and we can do way more in therapy. And then I always like to explain to them that yes, the injection, whether it's cortisone or something else, um, may be a band aid and temporary. However, band aids are useful. Band aids don't heal our wounds, but they create environments for our wounds to heal themselves and our bodies to heal themselves. So that's the way I like to describe those kind of things is don't be hesitant to get them because it's just a short-term thing. We do a lot of things that are short-term, but it's going to create that environment for our bodies to heal, and we can do more in therapy. Uh, Maybe means neural therapy, which uses low dose of anesthetics to affect autonomic nervous system. I'm not sure. I don't know much about that, but I'm definitely going to look it up. That sounds pretty cool. Is it for like chronic pain where it may be like an autonomic response, like an over heightened autonomic response? So then the treatment is not so much almost like if the power plant is having an issue down the road, it's not that like my kitchen bulb is out. It's more at the source. So if it's thought to be more of a chronic thing and the autonomic system is a bit heightened, is it more to target like that aspect of like at the root of the problem? Um, Again, I'm not really sure, but I'm definitely gonna look more into that. If you want to send me any more info, feel free to reach out. That's pretty cool. All right, let's see. Well, we're at the hour mark here. I didn't even talk about my other injuries, but um, I will just talk about one real quick, and then we'll wrap it up here. Um, uh, so actually, it's so funny. There's a question about golfer's elbow. That's exactly what I was going to talk about. Um, I My elbow gives me pain occasionally. Sometimes it's worse, sometimes it's not quite as bad. But it started when my first daughter was born, because I was obviously lifting and doing pull-ups, rows, um, all kinds of things with my grip and my wrist and forearm. And then I was also working, obviously, as a physical therapist, so I used my hands a lot. And then I was constantly carrying my daughter, and I'm left-handed, so I would carry her in my right hand, and this way I'd have my left hand available to type or write or cook or something. Not that I'm holding my daughter over the stove as I'm cooking. If my wife is watching, nope, that's not what I mean. Um, After three kids, they all survive so far, so I can't, I have to have some confidence to me. Um, my elbow just started hurting so bad, and the thing is that the baby gets bigger faster than your tissues can adapt sometimes. So it was just she got bigger and bigger, and I'm not about to not hold my daughter if she's crying or if I have to rock her to sleep. That was another thing. She was not a great sleeper, so I would rock and rock and rock and rock and try to get her to sleep, and over the months and weeks, my elbow just really took the brunt of it all. So then what I did was I started, it got to the point where I couldn't even open like the refrigerator door without getting a sharp pain in my elbow. So what I did was I kind of broke down the movements that gave me pain. And the daily activities were like one branch of it all. I modified my activities. So I would reach for things with my left hand. I would try to not use my right hand to do things. Carrying groceries, I would take extra trips back and forth to the car. I know. All the men out there, I'm so sorry. I promise you, now that my elbow is feeling better, I carry like 13 bags at once to try to make one trip because that's just what we do. That's what we do. It's in our DNA. Um, but I just forced myself to take more trips back and forth if I was doing something like a grocery unloading, and I would just try to lay off it during my daily activities. Um, in the gym, I started using hooks. So I train in my basement. Since my kids have been born, I work out in my basement. So I don't have a pull down machine, but I do assisted pull ups and different kind of pull ups and things like that. So I started using the metal hooks that I would use for like an RDL on the bar. I started hooking those onto the bar to do pull ups. And then I had to modify, I was doing barbell curls, I had to modify those to use dumbbells. And that was all I did in the beginning. Um, and it helped a lot. I was able to get a great training effect, no pain or very minimal pain during training. And I would say I ran that through like really up until this day. So like years, I just started using hooks on all my pulling movements, and that really seemed to do the trick. Felt way better during the day. No functional limitations. And if it's just a matter of using some hooks on some pull-ups and using dumbbells or curls, like heck, I'm game. Like count me in. Never had to get an injection. Never had to get X-rays, MRIs. Never took any medication for it. Just kind of modify what I was doing, change what I was doing at the gym slightly, and managed to kind of stay the course. However, as of recent, um, my schedule has been a little bit crazy. So sometimes I'll start workouts in my basement and finish them at my office. And I didn't have my hooks at the office. So there was a good maybe like month or two where I was doing just full hanging pull-ups, not assisted pull-ups, just full hang pull-ups from a pull-up bar. And I didn't have the hooks, so I would just do pull-ups like normal. And it felt great. I didn't have any pain, no issues. And then it just kind of built up, and I would start to feel a bit more sensitive, then a bit more, then a bit more. I have 3 kids now, so like I got a baby and then the 2 older kids and carrying them and carrying them. It was just all kind of manifested into this elbow again, and it was on fire recently. And I'm saying to myself, gosh, like what the heck am I going to do? Why'd this happen? And so I realized it was from the pull-ups without the hooks. So now if I'm going to do any kind of pull-up away from my home gym in my basement, I make sure I have the hooks. And I've done that for 3 to 4 weeks, and it's been feeling great. So again, just giving you examples of how you can work around these different things. And this idea of maintenance physical therapy, to kind of put a bow on all this, is not so much a prescription of exercise, it's a prescription of stretches. It's not about having endless mobility or endless stability in your joints and core stability. It's really about understanding your body, understanding that there's flexibility in training and in life, and just trying to figure out how to work around it. Pain is something that we're going to have. It's not feasible to think that we're never going to have pain. But the important thing is that we're able to approach the pain mentally in a logical way, and be able to kind of modulate that pain, modulate those symptoms to not restrict us both in the gym and in our lives, to kind of reduce our quality of life. So I guess we'll keep it there. It's been awesome being here with you guys. I always love doing this, and I'm hoping to do many more in the near future. So everyone have a very, very Merry Christmas. If you celebrate Christmas, Happy Hanukkah, Happy Holidays. It's a great time of year. Hopefully you're spending it with family and friends. Have a very happy, healthy New Year, and I will see you in 2026. Bye, everyone.